Hello, hi everyone. This is Dr. Sindura, your consultant obstetrician and gynecologist, laparoscopic surgeon at Arete Hospitals, Gachibowli. So, your entire pregnancy is divided into 3 trimesters. The first trimester is as soon as you conceive till the first 12 weeks of your pregnancy. This is the phase where you are very new to your pregnancy for the first timers. They don't know what to do, what not to do. This is the phase where you have a lot of nausea, vomiting, breast tenderness, breast heaviness, little irritability here and there because you're new to all these pregnancy hormones. So during this phase, the first scan is what you will have and a few antenatal tests and risk screening. That is, they take your detailed history regarding your personal and family history and all your habits. So depending upon your risk stratification, there are a few kind of investigations that you will have to undergo, and the first and foremost thing is a dating scan, which is the first pregnancy scan, ideally done between 6 to 10 weeks in order to date your pregnancy right. For few people, in case they have irregular periods, this scan is must in order to date your pregnancy and fix your delivery date. This is the time when you'll be given folic acid and few multivitamins, which are very essential for your baby's brain development. Along with that, sometimes you'll be given some progesterone therapy, which is always important in case your gynecologist or an obstetrician has advised you to please take it. So always better to take this until the placenta takes over the progesterone, which is the hormone of pregnancy. The second trimester is from 13 weeks till 28 weeks. This is the phase where it's called the most happiest phase, where every mother would want to enjoy this phase because this is the time where usually by 14 weeks all this nausea, vomiting of pregnancy which is there in the first trimester is going to settle and they start enjoying their pregnancy. So between 11 to 13 weeks is the time where the most important scan, which is the NT scan, in order to rule out any chromosomal abnormalities or any suspicion that can be picked up with this scan, which is the first and the most important scan, which should never be missed. Along with that, there are few tests such as the double marker, quadruple marker or the pentamarker test, which are going to stratify the risk that your baby is going to have a trisomy or any chromosomal abnormality can be picked up at this phase. That's the earliest. And this is the time where they usually give the vaccination. Most important is the flu vaccine, which is given now after this scan is over. The second trimester is which starts from the 13th week till the 28th week, where you will be given iron, calcium, folic acid and vitamin D supplements. Along with that, you will have the very most important scan, which is the anomaly scan, also commonly known as the TIFA scan. This is where they'll show your baby's eyes, ears, nose, mouth, hands, fingers, legs and all the internal organs if they're developed as it has to happen in the right way. So never to miss the scan, ideally done between the 18th to 20th week of your pregnancy. After this, you can schedule your scan for a fetal echo to pick up any cardiac anomaly. Ideally these days, we are always advising it to be done for everybody so that we don't have any surprises after birth. And the 24 to 28 weeks again is the most important period where you will be screened for diabetes or the initial thyroid. Even though it's normal, you get your thyroid test repeated now and also have a urine culture and the urine examination done to pick up any infections, and a routine blood test is also done during this period. And after the 28th week is your third trimester that which starts, where your abdomen comes, where your uterus keep on increasing in size and your abdomen tends to show that you're pregnant. This is when is a little discomfort for the mother. So according to the guidelines and according to the research and our experience, it's always better to take a Tdap or a Obstetrics vaccine between 27 to 36 weeks. That is at least a minimum of 4 weeks prior to your delivery, which is the best vaccine now, which is recommended as per the latest guidelines. After the 28th week is when usually your obstetrician would advise you for a growth scan. Till you deliver, you would have about 2 growth scans. The first one at 28 to 32 weeks and the next one maybe at 34 to 36 weeks to see what is the growth and the catch-up growth. In case there is any lag in the growth of the baby is when it can be picked up early and the treatment can be initiated as needed. So for further queries, please get back to us and we are here to always guide you and help you have a happy and a healthy pregnancy. Thank you.